I'm Jesse Wark, and I'm a registered nurse working in aged care. I currently work in management within aged care, so it has some clinical aspects where I'm working and supporting nurses in the day-to-day care of residents living with a diagnosis of dementia. But it also involves, I suppose, the day-to-day logistics of running an aged care facility. So staff management, family management, and all the things that go along with running an aged care, especially at this time right now within a COVID crisis. At first, when the COVID crisis was outworking itself within the whole healthcare setting, aged care, there was day-to-day changes. And so we were working to keep families involved and understanding what was happening and where we're up to, trying to make residents feel safe and comfortable, and all the while protecting them from the potentially being infected with coronavirus. And so there were some real challenges in that. There still is, and so the past 6 months has really been a lot of work, just lots of day-to-day changes and supporting families and residents. Working in a healthcare setting has its challenging days normally. So there's some days where it's great, some days that it's really, really hard. I think this just added another complexity to that. So managing, COVID response has just meant that we have to really think through a lot of processes that were quite normal to us and have to think through how we're going to do these things to make sure everyone's safe. That includes people visiting our facility, allied health, medical professionals, and also making sure families can see their loved ones. Our residents don't always understand what coronavirus is and why their life is a little bit different to what it has been. So some days are great, some days are really challenging. Overall though, it's just been another complexity on top of what's already a challenging environment. A lot of my residents have issues with memory retention, so they might not necessarily understand how long we've been under a different set of circumstances working with coronavirus. But I think the main thing for them is that just disruption to some day-to-day routines that they had, the amount of people who could come and visit them. We had to restrict at first, the amount of volunteers that were coming in and running some programs and engaging with them. We couldn't have dog therapy in for a long period of time, and just restricted visiting hours for families was really challenging. In the facility I work in, families weren't restricted at all at any point prior to coronavirus. They could come and visit their loved one at any time, stay for as long as they liked. And that had to change for a small period of time, and it still is changed right now. There's still some restrictions around that. It's always difficult to restrict any families visiting to their loved one, especially when you're trying to manage that for the resident and so that they're feeling safe and loved. We have been able to virtually keep visiting going the whole time through this coronavirus crisis, but at the same time with a lot of restrictions on making sure that we're screening everyone before they come in so that no one's coming in with any signs or symptoms of feeling unwell at any point. But yeah, telling families that that's going to be restricted is a difficult conversation. I think there's been elements of it that have been absolutely challenging, and there's been some days that you wake up feeling like you've got a headache just from the amount of thoughts that have been going through your head during the night. But my passion for what I do and the passion for the people that I care for has meant that I have really kept the love of what I do, no matter, I think, what we face. I think that keeping healthy, getting outside, being physically active, managing not just your physical health but your mental health in that space as well is absolutely essential, whether we're facing a pandemic or not. But I have found it such a key element to keeping sane during this season, and being able to make sure that I'm staying fit for my family but also for those I care for has been really important. Yeah, so I've always surfed, I loved it, and I've been getting out and doing that fairly regularly. A couple of years ago I took up running and really fell in love with it. So lucky to work on the Central Coast and live on the Central Coast, and so have had opportunities to run to work and run home, run before work, run after work, whatever it is. I like to try and get out and run 3-4 times a week. Shorter distances, sometimes longer distances if I've got the time. Got 4 kids at home, so longer distances aren't always as easy as they used to be. But no, really enjoying it and getting out there and putting those kilometres in, getting them in and just hammering away. There's so many benefits to your cardiovascular health, to your general fitness if you're keeping outside and exercising. For your mental health, it's amazing, you know, making sure that you've got good hormone control, regulating your emotions. But I even just find, like I said, I like to run sometimes a slightly longer distance. So getting out and just doing a run for an hour to 2 hours and not having the noise of the world, not always having your headphones in either, just sometimes getting out there and running and listening to the bush, that just does so much good for me. Keeps me sane, keeps my thoughts just, it means I can go home to my family and I'm not taking anything home. I've dealt with it and I've put it aside, and I can give my family my best. Now's a great time to stay in aged care. Personally, I think that our residents need us more than they ever have before, and when we get on the other side of coronavirus, whatever that world looks like, the lessons that we've learnt through this is going to be absolutely essential to making sure that we are providing the best care no matter what organisation or area you work in. But I think if you're living in coronavirus world right now and you're working and you're trying to do what you're doing, that's definitely stressful. And if you're not active and you're not out there doing things to keep yourself physically active and exercising well, you're doing probably some damage to yourself and disservice, and stress levels I'd imagine be really high. So I'd encourage you, even if it's just getting outside and doing a kilometre walk, 500 metre walk, walking for 20 minutes, whatever it is, just get outside and get started, and get the love of being outside and exercising in you, and before you know it, you'll be doing more than you could ever imagine.